Now, the Ministry of Health is undertaking a review of the list of diseases that the National Health Insurance Scheme currently covers, to include diabetes and other diseases. That's according to the Deputy Minister of Health, Mr. Alexander Kojo-Aban. The ministry is undertaking the exercise because of the effects diabetes has on families. The Deputy Minister, however, warned Ghanaians to desist from consuming fast food as they complicate the health of many in the country. He was speaking as a commemoration of the World Diabetes Day in Cape Coast. Richard Kojo-Nyako has more.
According to the Deputy Minister of Health, Alexander Kojo-Aban, the review might take into consideration the inclusion of diabetes in the diseases the National Health Insurance Scheme covers. He makes a special case for it.
The ministry is actually doing a review of the package that must be given under the National Health Insurance Scheme. They are actually considering diabetes and other diseases too. And so we are looking at all these things side by side to see whether it will be sustainable to include this. But there's a lot of talk in making sure that we include some of these diseases, because the effect it has on families is so grave that once you are a poor person and, for instance, you are diagnosed of diabetes, it's just like your death sentence.
The Gomoa West MP wants Ghanaians to take what they consume seriously by reducing the intake of fast foods and other fatty foods that have proven to be fertile grounds for diabetes.
This craze of going to the fast food joint and going with our children to enjoy pizza and soft drinks and all that, and that seems to give us some status symbol that, yes, we have arrived. We should rethink that, because, you see, we do these things and we think that, we are now enjoying the white man's food. But you go out there in Europe and in America, they themselves describe this kind of food as junk.
President of the Diabetes Association of Ghana and chairperson of the International Diabetes Federation, Elizabeth Denyo, called on government to fashion out a national diabetes plan and also train nurses who would be solely for the management of diabetes in Ghana.
Our appeal to the government is to control advertisements. There are a lot of adverts saying they have a cure for diabetes, treatment for diabetes. Government himself know diabetes was first discovered in 1811. They still haven't had cure for diabetes. We can control and live with it. So the advertisements, the herbal preparation on air stating that they've got a cure for diabetes must be regulated. We need a national diabetes plan, because something that is growing so quickly amongst your population, there should be a government plan to curb diabetes. We want a diabetes control program. Nurses don't seem to have knowledge in diabetes education. So we want nurses to be specifically trained in diabetes education and diabetes management.
The Ministry of Health, in response to queries about some individuals and companies who roam the streets and advertise that they have a cure for diabetes, says the ministry would liaise with the Food and Drugs Authority to crack down on such persons and companies. Richard Kojo-Nyako, Joy News, Cape Coast.